So these are the different parts of the basal ganglia that you should remember. So identify these structures. Let me see one last time. What is A? What is B, C, D, E, F, G, H? If I ask you which is the site of hypertensive bleed, remember the most common site of hypertensive bleed is putamen. So you have to identify the putamen. If I ask you which is involved in Huntington's chorea, Huntington's chorea is atrophy of caudate nucleus. So you have to identify the caudate nucleus. This is the caudate nucleus. If I ask you which is the sensory relay center, all sensations relay in thalamus except the olfactory. So you have to identify the thalamus, sensory relay center. This is the thalamus. And if I ask you where are the corticospinal tracts passing, they are passing through the posterior limb. So this is the posterior limb. The corticospinal tracts, they pass through the posterior lumbovitreal capsule. Corticospinal tracts, they're passing in the posterior lumbovitreal capsule. Melatonin production is pineal gland. CSF production is choroid plexus. So they can give you this thing and you have to identify what are these. Okay, so these are the different structures in the basal ganglia. Now, look at this image. What is this image? Then what do you think is this image showing you? What is this structure? Is it midbrain, pons, or medulla? Let me see if you can answer this. Thank you, Puneet, Suraj. Right? Can you just tell me quickly what is this image showing you? What is the arrow pointing to? Is it midbrain, pons, medulla, or spinal cord? Is it midbrain, pons, medulla, or spinal cord? If you see carefully, you can see this is the basilar artery. This is the basilar artery. If you're seeing the basilar artery, this structure becomes pons. This structure becomes pons. So the important landmark that differentiates midbrain from pons is basilar artery. And once you have identified the basilar artery, this structure anterior to pons is your prepontine sister. This CSF space posterior to pons is fourth ventricle. So the CSF space anterior to pons becomes prepontine cister, posterior to pons becomes fourth ventricle. These are your mastoid air cells, right? So these are mastoid air cells. These are your lateral sulcus on either side. These are the lateral sulcus, right? So all of this, the sylvian fissure or lateral sulcus, these are important. This is the vermis, and this is the cerebellar hemispheres that you have on either side. Okay, so this is the different structures. You know this by now. Okay. Try to answer this thing. What is this thing? The imaging modality of choice in a patient presenting with hemiplegia or cerebrovascular accident. Which one do you want to do? Which one do you want to do? The imaging modality of choice in a patient presenting with hemiplegia or cerebrovascular accident. Do you want to go for MRI, ultrasound, non-contrast CT, or do you want to go for contrast-enhanced CT scan in a hemiplegia patient? But whenever you have a stroke or hemiplegia or cerebrovascular accident in your patient, the first investigation that you like to do is a non-contrast CT. Then the answer should be a non-contrast CT. On non-contrast CT, if that area appears hyperdense, white, this is hemorrhagic stroke. Good. All of you have answered it correctly. Answer this, right? Puneet, Ahil, Neha, right? So this is non-contrast CT. Hyperdense means white. If it is white, that is hemorrhagic stroke. But if it is hypodense or normal, this is ischemic stroke. So even a normal CT scan should be considered an ischemic stroke and started on thrombolysis. Even a normal CT scan in a case of hemiplegia should be considered ischemic stroke or acute infarct and started on thrombolysis. Acute. Okay. And look at this next question. Which anatomical variant is given in the given CT scan?